Hello, I am Dr. Rajiv Vaishampayan, practicing urologist since last 43 years. Today we are going to talk about the commonest urinary tract problem, that is renal stones. These are the stones which are formed because of excessive precipitation of the salts present in the urine, which are being thrown out of the body by the way of kidney. But when the excessive amount of salts they precipitate, they form the stones in the kidney or urinary tract. These stones are about 7 to 8 different types, which normally occur because of lack of proper fluid intake and sometimes few other maladies. These stones normally cause the pain in back or radiating to the abdomen or downwards. Many a times urinary tract infection occurs because of the presence of the stones. All these things which they occur because of lack of fluid in a proper amount, as so many people are working in the air conditioned environment where you don't have a proper thirst, and one tends to avoid drinking more water. One should purposely drink more water so that every time the urine should look like plain water. Whenever there is a yellow tinge or reddish tinge, you should increase the water intake by 1 or 2 glasses of water. These stones can cause obstruction to the urine flow and cause many other problems like fever with chills or rigors. The treatment for all these stones is basically a medical line of treatment to start with. It depends on the size of the stones. When they are small, one tends to treat it by medical line of treatment, that is medicines and syrups, which try to expel them out of the body or reduce in size so that they can travel down to the bladder and will be expelled by the body. When these things doesn't occur even after the long treatment, we have to go for a laboratory test, that is blood and urine. Different types of tests are available to see the working condition of the kidney and the presence of infection in the urine. And another form of is surgery or endoscopy. These things are required when medical line treatment fails, and then one has to go for surgery. But that depends after, that can be detected by the x-rays or the CT scan functioning of the kidneys by way of intravenous pylography. One should not be hesitant to drink more water, as that is the best way of treatment to prevent the stone formation. Many times all different types of diets are prescribed. These things should be avoided, but that has a very minimal value unless you drink plenty of water to keep all these salts in the solution form. Thank you.